I went to medical school at the University of Wisconsin. I did my residency at William Beaumont Hospital in Royal Oak, Michigan. I did my fellowship with consultants in ophthalmic, facial, and plastic surgery in Southfield, Michigan. I've been practicing ophthalmology for about 8 years. Time really flies when you like what you're doing. Mostly I see cataract patients, glaucoma, macular degeneration, and facial plastic patients, so patients who have droopy upper lids, droopy eyebrows, droopy lower lids or lower lid malpositions, and also eyelid cancer patients. I think the biggest misconception about especially upper lid surgery is that it's always cosmetic, which is definitely not true. 80%, even 90% of the upper lid surgeries I do are medically covered because as the lids droop, they definitely impair your peripheral vision, and people will notice that when they're reading, they're not getting enough light in. When they're driving, they're having to turn their head in order to see, or always constantly lift their eyebrow, tip their chin up to compensate for the fact that they're not seeing. But often it's an easy fix through an eyelid surgery, or sometimes it's a matter of just lifting their brow, especially the men who have a prominent eyebrow here. They will find that as that brow falls, it really obstructs the vision. Cosmetic injectables are becoming more popular these days, and definitely that population has expanded for me over the time that I've been here. Botox works great for dynamic lines, meaning lines that happen when you're making certain facial expressions. When you smile, the eyes tend to crinkle up. When you frown, you can create these, we call them 11 lines. That Botox works great to relax out and prevent further deepening of as we all age. The other thing that I use would be fillers for lines that I call static lines, meaning lines that are there all the time, even when we're not making an expression. So Radiesse is a terrific filler that I put in here. Those are your nasolabial folds. And here for those downturned mouth lines, we call them marionette lines. I also use Restylane, which is a thinner filler for filling in the lips to erase the perioral lines, as well as filling in this area. That would be those 11 lines again that can sometimes make people look angry, even when they're not. They're safe, and Botox is known to last for about 3 months. The fillers are known to last about a year. I just want to take good care of patients as if everybody is my own mom or dad. Restore their vision, give them the best vision that they can possibly have, no matter what kind of eye disease they have going on, or whether it's a surgical issue or a medical issue. Just do good for the community.